So now, I previously posted part one of my story, and I guess you could say this is part two. Part one went up to 2015, and things were looking very nice. Here I'm continuing with part two. So, after my successful bout with the immunotherapy, in mid 2015, it stopped working. The cancer in my lungs started to grow, and since I had been part of a clinical trial, they decide whether you are able to continue or not. And unfortunately, they decided I wasn't able to continue. So they took me off the clinical trial. To say I was devastated is minimizing how I felt. My miracle had been taken away from me, and I didn't know where to turn. My oncologist thought that since my other tumors had not grown, that it was possible that we could do lung surgery. I saw a lung surgeon. She was able to successfully remove 2 lobes from my right lung, and I was in the hospital for about maybe 3 or 4 days, and then my recovery was about, to be very honest, 6 months before I could actually say I was back to where I had been. There were some ups and downs there, but we weathered the storm, and after that 6 months, they decided that they could try once again to put me on immunotherapy. This time, we did not use a clinical trial, we just used the drug. And so, since that time, I've been on immunotherapy. I was going every 2 weeks, then every 3 weeks, now it's once a month, and it seems to be working. There are some side effects that are a little bit troublesome. I have very severe neuropathy in my hands, and so my hands are virtually useless. I have a good deal of discomfort, and again, as I said, I can't do anything. But my doctors are trying to tweak my medication to see if it'll help. I also go for hand therapy, and so we're addressing the issue as best we can. 2 things have carried me through the past 5 years. One of them is a mantra that I truly believe in. Life is what happens to you when you're making other plans. And when you have cancer, that's definitely true. And the second is one day at a time. And that's how I think you have to approach the situation, because looking too far in the future is not a helpful thing to do. So I'm cautiously optimistic, because right now I'm doing all right, and we'll see where we go from here. Some things that I should maybe mention to you is I have been very fortunate. I have unconditional support from family, from friends, from my doctors, from former colleagues at work, and it's amazing to me what a wonderful place this world is, because people have stepped up to the plate. People have just been in touch with me and told me that they're thinking of me or praying for me, and it's so rewarding because it makes you feel like this world is a truly compassionate and beautiful place. The other thing is that I truly believe in the value of support groups. I belong to What's Next. I can't imagine that there is a better support group around. I belong to others, but support groups can run the gamut. They can be kind of like doom and gloom or clinical, but What Next has a good balance of realistic viewing of our conditions, recognizing that sometimes it sucks, and compassion on the part of other members who offer suggestions, who offer support, who are cheerleaders when things are going well. And that's something that's somewhat rare. I think that's the end of my story right now, because I'm up to the present time, and this is where we are. I hope that I've helped you in some way. And remember, keep strong, God bless, and thank you for listening. That's great.